In this video, I'm going to tell you all about atrial fibrillation. Whether your loved one has been diagnosed with atrial fibrillation or you're just curious about heart health, I'll help you to understand what atrial fibrillation is, its symptoms, causes, and the treatment options currently available. If it's your first time here on my channel, my name is Hafiz and I'm a cardiologist training in London. I created this channel to increase awareness of heart disease and to tell you how you can improve your heart health. If that interests you, then click the subscribe button and the bell icon so you're up to date with all my videos. Atrial fibrillation is commonly referred to as afib or AF for short. I'm going to call it AF for the rest of this video. It's estimated that around 60 million people worldwide have AF, and the numbers are rising. It's especially common in people over the age of 65, but it can affect younger people as well. To understand AF, let's first take a look at the heart. Your heart has 4 chambers, 2 atria on top and 2 ventricles on the bottom. The atria and ventricles work together to pump blood in a coordinated rhythm, thanks to electrical signals generated by the heart's natural pacemaker, the sinus node. But in AF, the atria experience chaotic electrical activity. Instead of beating in a coordinated manner, they twitch or fibrillate. This causes your heart to beat randomly, which means it does not pump blood as well as it should. AF is a type of arrhythmia, which is a problem in the conduction system that can make your heart beat too slowly, too quickly, and in an irregular way. AF is the most common type of arrhythmia. There are different types of AF. Paroxysmal AF, when the symptoms start and end without treatment. Persistent AF, when the symptoms last for longer than 7 days, or when it's treated. Permanent AF, when you always feel the symptoms and are usually getting treatment. And long-standing AF, when you've had the symptoms usually for over 1 year. AF itself is not life-threatening, but it can create blood clots in the heart that may cause a stroke. If you have AF, it makes you 5 times more likely to have a stroke. Okay, so what does AF feel like? The common symptoms of AF are palpitations, chest pain, dizziness or feeling faint, breathlessness, and feeling generally tired. Some people have no symptoms at all, and their AF is discovered during a routine checkup. Now let's talk about what causes AF. While sometimes the exact cause is unknown, there are several risk factors that increase the likelihood of developing AF. These include high blood pressure, a previous heart attack, diabetes, a family history of AF, conditions like sleep apnea, and lifestyle factors such as smoking, excessive alcohol, caffeine, or stress. Older age and pre-existing conditions like thyroid problems also play a significant role. AF usually gets noticed when a healthcare professional is checking your pulse during a physical exam or health checkup. If they think you may have AF, they will send you for more tests, typically an electrocardiogram or an ECG. This is a simple test which records the heart's electrical activity. In some cases, your doctor may recommend a Holter monitor or event recorder to track your heart rhythm over a long period. You can check your heart rate by feeling your pulse at your wrist. A normal heart rate is regular and usually between 60 and 90 beats per minute when you're resting. I have done an entire video showing you step by step how to measure your own pulse, and I'll link to it somewhere on the screen. If you have AF, your pulse will have no set pattern, and beats might have different strengths. Some devices like smartwatches have tools that can help notice AF. This can be useful in first finding out about an issue with your heartbeat, but only a healthcare professional can diagnose you with AF. Treatment of AF involves restoring a normal rhythm, if possible, controlling the heart rate, and preventing complications like stroke. In AF, lifestyle plays a huge role. Quitting smoking, reducing alcohol, exercising regularly, and eating a heart-healthy diet can make a big difference. Medications such as beta blockers can be used to slow the heart rate, and antiarrhythmic drugs to restore normal rhythm. One of the most serious complications of AF is stroke. That's because the irregular heartbeat may allow blood clots to form, which may travel to the brain. This is why anticoagulants, also known as blood thinners, may be needed. We use a scoring system called the CHADS2 VASC to calculate stroke risk for patients with AF. It considers all the risk factors that put you at increased risk of having a stroke. One of the complications of blood thinners is bleeding. We can use the has-bled score to estimate risk of bleeding for patients on blood thinners to assess risk-benefit in AF care. These can be used in discussion with patients to facilitate shared decision-making regarding the risk of stroke. For some people, medications aren't enough. Procedures like electrical cardioversion, catheter ablation, or the implantation of a pacemaker may be needed. AF will affect your life, but it's a manageable condition. With the right treatment plan, lifestyle changes, and support from your healthcare team, you can lead a full and active life. Do you have AF? What's your experience been like with the condition? Tell me in the comments below. Share this video with someone who might benefit from understanding AF better. Thank you for watching, and I'll see you in the next video.